St. Luke's University Health Network in your community.
So orthopedic surgeons treat the musculoskeletal system, parts of the body going from the neck to the back, shoulders, knees, hips, and foot and ankle issues.
Dr. Tenpenny is part of the orthopedic team at St. Luke's University Health Network with an office in the Monroe Campus. When people are injured or have chronic conditions like arthritis or lower back pain, they often visit an orthopedic doctor. Orthopedic injuries can happen anywhere.
Playing sports, in school, on a job, on vacation even, or just even at home. So, people trip going down the stairs, they might trip going down their car, slip on the ice.
Dr. Hercules is also in St. Luke's orthopedic department. He says pickleball has become very popular and injuries can occur.
We've seen a range of a lot of ankle sprains, Achilles tendon injuries. You could plant and suddenly to explode to go over that ball, and you could pull a hamstring, just your typical tennis elbow stuff. You start to experience that pain on your elbow, maybe coming down your forearm, and also shoulder stuff as well too. A lot of pinning back and forth swing, trying to go for the ball.
So how do you know when it's time to see an orthopedic doctor?
I wouldn't say everyone who has some level of pain, you have to get in immediately and be seen, but it's really when it starts impacting your day-to-day activities, or it's just becoming more of a nuisance, and that can, the gauge for that can be different for everybody.
Both doctors agree that every patient is different, and so are the treatment options.
The goals of treatment are going to be different from, in a 17-year-old athlete than a 75-year-old grandparent who is looking to get back to holding their newborn grandchild. So a lot of different treatment goals depending on those type of things and the type of injuries that they have to begin with.
Dr. Hercules uses visual aids and diagrams to explain the problem.
Believe it or not, I'm a fan of using pictures, but even in the room, fortunately we have computers, so I can, in the room, go on the internet and say, hey, this is how you look up, and I show them. You type in a certain body part anatomy, and I'll point out, oh, well, this is that muscle, this is the cartilage cushion there, kind of acts like a Dr. Scholl's.
Knees can give people problems as they get older.
Typically when they have persistent pain, instability, swelling, locking, and these symptoms seem to be getting worse, or they're not improving with over-the-counter medication or anything like that, it wouldn't be a bad idea to get in, see a doctor, maybe get some imaging, get examined, and see if there's other things we can do to improve those symptoms for you.
And most of the time, you don't need surgery.
Let's say someone has a torn tendon, torn ligament. Yeah, surgery's not always needed. Sometimes just time and rehab can allow healing. And then we also have a number of, my colleagues are doing what I call platelet injections now, where they take your body's own blood, they process that, and then re-inject it back into that injured site, and kind of helps the body naturally heal on its own. That's also combined with doing some therapy to make sure rehabs properly. So there are a number of options for people to get back out there without becoming invasive.
But if you need surgery, Dr. Ramsky says St. Luke's Orthopedic Department offers quality care.
The quality measures the quality initiatives, the outcome measures are always off the charts. I think that compared to local hospital networks or even Medicare ratings, we're always improving, and we're a growing hospital network. The orthopedic department itself is growing like rapid fire.
Orthopedic trauma can involve anything from car crashes to job-related injuries and even hip fractures.
With the aging population, hip fractures are a huge portion of the healthcare expenditure in the country. So we definitely do a lot of hip fractures. It's very common, but ankle fractures, lower extremity, wrist fractures, all very common things.
Fractures can occur in any part of the body, but depending on your tolerance for pain, you may shrug it off.
A patient will come in 3 or 4 weeks after something happened and say, I never really thought much of it, that kind of thing. Then now we're dealing with something where we have to kind of, go back and, deal with the problem. If you're having pain every time you're taking a step, that's the time to get it checked out. If you do think you've broken a bone and you see bleeding coming from that area, that's the time to go to the emergency department. Or if there's any numbness or tingling or loss of sensation or motor function in your fingers or toes, or can't move an ankle or can't move your wrists the way you thought you could before, that's the time to get checked out for sure.
Dr. Ramsky says recoveries can range from short to long term.
A huge part of orthopedic trauma is not just, fix the bone and walk away. That's kind of where the clock starts. sometimes lower extremity injuries, if they're bad enough, you can be off of that extremity for 3 months. It's can be a very extensive recovery. Some injuries we fix and you can bear weight or walk right away.
All three doctors say everyone in St. Luke's orthopedic department works together as a team to give patients the best care.
Everyone is really engaged in wanting to treat patients and have good outcomes.
When patients come to us, say from a different network or out of state or different practitioners, very often we'll hear that, this is the only network that has explained to me my problem or talked me through what the surgery is going to involve, or they may not have felt comfortable with, sort of being brushed aside at a different place.
We have a huge team of specialists to choose from. We have hand specialists, spine specialists, rheumatologists. We have chiropractors now on board with us, spine and pain, joint replacement specialists. We also have surgical oncology, pediatric specialists, and it keeps growing.
St. Luke's offers a range of orthopedic services, from fracture treatment and joint replacements to pediatric orthopedics and rehabilitation. Their team can help you regain mobility and live a healthier, pain-free life.